the sexuality concept. So as our introduction to this, I want you to get your concepts book, and this is concept 21, sexuality and reproduction. And I'm going to go ahead and share your concept analysis diagram. Do a little screen share with that. So you can look at the attributes, the antecedents, the interrelated concepts, just, be looking at that as I'm talking, and determine where a lot of this fits in, as I'm talking about it. Let me see about turning the light on a little more here. Better? Okay. So sexuality. So it says in general, that is how people experience and express themselves as sexual beings. It includes our body parts and sex. What does that mean? It includes a penis, a vagina, but also the actual physical act of sex. It's that sense of being a girl or feminine, or being a male or masculine, regardless of what body parts you have. Sexuality includes how you express your sense of gender, who you are attracted to, and who is attracted to you. Sexuality is unique to the individual. It's core to who we are, and it's dynamic. And sexuality, I just want you to know, if you haven't looked at Maslow's hierarchy of needs, reproduction is actually on the bottom, one of the most important needs, along with elimination, food, air, and circulation. So it's important. So from our concepts book, after that, let's look at motivation, because libido is going to be something we're going to be discussing here in a minute. Motivation is the desire to engage in sexual activity. Libido, or sex drive. Says it's a biological, psychological, sociological, and spiritual in nature. So the libido can have a lot of different variations to it. It can be impacted by medical conditions, medications, and we're going to be looking at that as well. Personality, temperament, lifestyle, different things. So you need to know the libido and what all is good or bad for the libido. So turning the page, I want you to look at table 21.1, where it gives you definitions related to the concept of sexuality. And you'll need to know what these mean. What does it mean to be bisexual, gay? What does gender identity mean? Homosexuality, lesbian, LGBTQ. Sex, what does that mean? Sex identity, transgender, and transsexual. Make sure you have a good understanding of that. I do also have some resources in Canvas for you to click on and look at as well. All right. Along with our sexuality concept, we're going to be talking about sexually transmitted infections. And let's just go ahead and hit that real quick here in your introduction phase. So among the most common sexuality problems are STIs. The old people may call them STDs, but they're now STIs. And they are infections transmitted through sexual contact. And it talks about the different types of infections that you can have. Viral and bacterial are the two that I focus on. So we'll be looking at that. Some STIs are curable with treatment and others are chronic. And you're going to see again the difference between bacterial and viral when we're looking at that. Female sexual disorders. Again, we're going to kind of go through. It talks about hormones playing a factor. And when we talk about hormones, it's when we talked about menopause. We know that decrease in estrogen and progesterone lead to painful sex. Dyspareunia, I think that's how you pronounce it. So always go back to that when you're looking at female sexual problems. And if they have pain with sex, then they're probably going to have a decreased desire for sex, which would be a decreased libido. Male sexual disorders, what we're going to be looking at here is going to be erectile dysfunction, or ED. And there's many different things that can cause that we'll be talking about as well. Okay, so then let's go over to this next page. It talks about sexual orientation and identification, lesbian, gay, bisexual, transgender, and queer. Again, know what those mean. And then individual risk factors, looking at high-risk behaviors. We know that sexual activity is normal based on Maslow's, right? It's something that you have to have. It is a need. But it talks about whenever you have sexual activity, there are some things that will influence high-risk behaviors. And that's something that we need to think about. You know, if you're using excessive alcohol, marijuana, drugs that increase sex drive, people may not be as prone to having safe sex if they are under the influence of these environmental substances. It says the abuse of alcohol or drugs most often results in impaired judgment and consequently less thoughtfulness related to the sexual act itself. In other words, decreases inhibitions. You're not going to be so worried about safe sex. And the underlying medical conditions, again, it says a lot of medications can affect sexual health. We're going to be looking at this with erectile dysfunction later on. I do want you to look at box 21.1, common medications that reduce sexual desire or response, so diminish the libido. And this is something that's going to be important to know. So look at all those medications that are used or that are noted in that box. Then we're going to jump over to screening for sexually transmitted infections. Screening is based on the level of risk. Of course, you have to be comfortable talking to somebody about their sexuality and their sexual practices in order to know what their level of risk is. So that is something that you're going to have to develop a comfort level with. So it's based on sexual behavior, includes unprotected intercourse. You know, that's not good. Having sex with multiple partners, adolescent onset intercourse, sharing IV needles, and if they have a history of STIs. This is for individuals that are at increased risk. Periodic screening for chlamydia, gonorrhea, syphilis, and HIV is recommended. And then if you look at collaborative interventions, your pharmacotherapy, it says to treat infections of the reproductive tract. They have a wide range of antibacterial, antiviral, and antiprotozoal agents. And we're going to find out when we get a lot more in depth with the STIs. Some of them cannot be cured. They can be treated. but they can't be cured. Some of them will become chronic, and those are going to be viral. Hormone replacement therapy. Again, women may want that to help with the painful intercourse that they're having, because it does reduce vaginal dryness and hot flashes. But we've already discussed in menopause, only certain women are candidates for hormone replacement therapy. That's not something that everybody can have. And it talks about the low dose estrogen for women that have had a hysterectomy previously, or combination estrogen and progesterone if they still have their uterus. Then these inhibitor medications, when we are talking about erectile dysfunction. So we are looking at Viagra, right? It's a first-line treatment for erectile dysfunction. They act by relaxing the smooth muscles in the penis to create or increase blood flow and compress those veins. And those actions result in the penile erection with sexual stimulation. So it'll rise to the occasion, or it will work as intended. And then if you just look at your surgical procedures, because this isn't really discussed anywhere, but I've actually come across this in practice, this penile implant surgery. So it's the insertion of inflatable device in the penis, and the reservoir is placed in the scrotum. So it's actually almost like a little pump in the scrotum, and you literally pump it up like this for that penis to get erect, for it to be pumping that penis up. I've seen this malfunction, and it would not release. So it created an erection that never went away, and this was super painful to this patient. So I just say that because this is still around, so you need to be aware of that. And then if you look at this figure 21.3, sexuality and the interrelated concepts, anxiety, lots of things go along with sexuality, lots of psychological things. What if somebody has been raped? How are they going to feel about having sex? What if they're afraid they can't get an erection? That's probably going to make them even more likely to not get an erection if they have that anxiety. Reproduction, of course, because we know how you reproduce. A new human is going to be sexual. Gas exchange. So again, we're talking a lot of blood flow. Stress and coping, and pain with that painful intercourse for women that we're talking about. And then when it turn the page, and we're going to look at some of these clinical exemplars. Erectile dysfunction is one we're going to talk about. Menopause, we've already talked about. I'm not going to talk about that again, except just to remind you about the painful sex because of those lack of hormones to help lubricate the vagina. So that's going to be what my next lecture is going to be over. This is just your introduction.